Well, we've talked about the population of our region growing over the years, and that includes both adults and children. In fact, roughly 80,000 people under the age of 18 live in New Hanover, Brunswick, and Pender counties right now. Some of those children and teenagers, of course, might need surgical procedures, and southeastern North Carolina offers unique opportunities. So today, Dr. Christian Walters, a pediatric surgeon with Novant Health, is joining us to talk a little bit more about this, because the big thing is there are not many pediatric surgeons in our area. So thank you for coming in.
Yes, thank you for having me.
And welcome to Wilmington, being new to the area as well. So talk a little bit about why it's so important to have pediatric surgeons for parents to turn to right here in our area.
Well, it's nice to have pediatric surgeons here in the area, so you don't have to travel outside the Wilmington area to other parts of the state.
Yeah, surgeries can be such an emotional time for parents, children, and I would imagine doctors too, because it's a completely different kind of a ball game when you're operating on a small child or even a teenager than you are an adult.
Yes, it can be very rewarding at the same time.
And what kinds of surgeries do we see more in children? Is there one that's more common than the other?
Well, things like appendicitis, hernias, surgeries of the lung, intestinal tract, feeding tubes.
Oh, wow.
Are some of the most common.
Lots of different ones. Appendicitis, I always thought of that as an adult problem.
It is a very frequent problem in adults. About 10% of the population will get appendicitis sometime in their lifetime. A large percentage of that is during childhood. There's hardly a day that goes by that myself or one of my partners isn't doing a surgery for appendicitis.
That's so just unusual to me. What is the reason for that?
Well, it's a variable presentation and cause, and most of the time individually we don't know, but frequently it's precipitated by a viral infection or something that blocks the opening of the appendix.
Well, knowing this now, enlightening us on all of this, what should we look for? What should parents look for? Any kinds of signs that their child might have an issue with their appendix?
The classic presentation would be pain that starts around the umbilical region or the belly button and then migrates to the right lower quadrant. That said, our bodies don't read textbooks, and the presentation can be variable.
And this could be an emergency situation in some cases, right? If you don't notice it, don't get a hold of it right away?
Yes, absolutely. The longer it goes without treatment, frequently the worse that it is, the more complicated it is to take care of.
And is it always a surgical procedure? There's no other way to really...
No, in some instances we can use antibiotics alone. That's a newer treatment in children, and given their age, most of the time, most parents elect for operative repair and definitive cure.
Because it will really affect them later in life. It's one of those things that you can kind of do without.
That's right. Yeah, absolutely.
All right, Dr. Walters, thanks for coming in. Appreciate it.
Thanks for having me.